faster and easier to me to share uh, ideas or concepts that I might want to in this manner. It's right now through video, and I'm still recovering from health and so on. So, on this video, I wanted to talk about a present issue in Canada, particularly focused on the province of Ontario, which has to do with healthcare and introducing more private healthcare options in provincial in what is personally provincial funded healthcare. And while it is a wide topic, I thought I would make some points or highlight some points. Uh, One of the topics studies argue is about, which is valid. It's about how introducing certain things will affect others, and there are ways to at least address some of those things and also address other issues that are not presently. And one of those is, for example, introducing more robust laws that address medical malpractice, pharmaceutical malpractice, and so on. Why these things? Introducing laws that address this, make sure it's really important in Canada. It is significantly overlooked as a person who has suffered with a child who has suffered and no consequences. Addressing such things helps address situations such as, the cost and the over used of resources of the medical healthcare system. And it has increased. The lack of proper address of it has increased as well, and the reliance of, well, the government funds the system and therefore you will not receive this or that as the excuse as well. As someone who literally received that as the reasoning for literally being physically damaged, both myself and my son, for the rest of our lives, with a lack of quality of life that we already had, lost quality of life we already had, and the potential we already had that was there, etc., and giving such answers. That's sort of my level of knowledge as someone who is someone who's in disability and who uses the system and who has seen the decline in the last 4 years, living in Ontario as well, in the city of Toronto, nonetheless, where there are lots of medical facilities, yet the access is still limited, and the backlog and so on, it's increased. So keeping those things in mind, addressing such systems, and even going and backdating helps address a lot of that pressure that has gone financially into healthcare due to medical malpractice, pharmaceutical malpractice, facility malpractice, abuse of access of us by by systems, if by pharmaceuticals, by doctors, etc., by systems. Addressing that brings a lot of income back, both into government and into people. And into people removes them from government assistance and so on that they now have to rely on due to such things and injustice being paired with it. So solutions as simple as that, believe it or not, it's at this root of issues, and targeting these things properly helps them remove the tensions, at least in financial, and by that expands and it opens opportunities. Other things is introducing new laws to perhaps I do consider that introducing private healthcare is a good thing, but it has to be paired with new laws as well. So not only those laws I mentioned on the medical malpractice aspect, both present, future, and past, even backdating it a couple decades, will be a good thing to help also reduce the tensions of the increased and help send create more significant system that gives justice to people. In the U.S., it is nothing like it is in Canada when it comes to medical malpractice. And I am aware of these by having known people very personally and talking very with legal both in Canada and the US who practice medical malpractice and having my own case, etc. about it to have my opinions, and I read about it as well, legal documents, and I've gone to school for legal and other things, etc. So keeping all of these things in mind, it comes to also to in the new laws of these things to make sure that things that are abusing systems or abusing patients or people and so on are properly addressed. The gouging prices are properly fair waged, and also, at the same time, by properly addressing the way that doctors are able to build and so on, not necessarily trying to compete with what private healthcare facilities, but offering more fair opportunities, helps keep doctors who are in it for the healthcare in public healthcare, because they have the means to live a proper life and fulfill also their needs personal and as a professional, by offering other opportunities, because there's both the payment but also the opportunities, the support, and so on. The resources and the finances come from addressing again the private sector and its usage. At the end of the day, the private sector is the one who's going to benefit the most. Making sure they're also paying their fair share of taxes and increased amount of things like that and so on helps again bring more money back into the governmental and system of addressing damages and so on happening to people, and this helps leverage all of these things. Simultaneously, believe it or not, these things rippling across society in other ways. And let's not forget that not taking proper care of the healthcare system and addressing abuses, both in the systems of injustices and medical practice, but also in the things causing these things, whether it comes from medical or other areas, including industrialization. It is important to look at it in the perspective of what happens long term across societies, civilizations, countries, nations, areas, and so on. The decline of health means poor economies, more reliance on systems, and the systems themselves, as they are fed by by people and the work of people and the contribution of people, decay. And it's not that people want to be lazy, as some people might often try to assume, but a decline on health, both physical, mental, and others, it's a decline on the whole system of what it is as society, as civilization. So keeping these things in mind and addressing or keeping these new rules, new systems, addressing all systems to help revamp what is there, at least financially, in access and balancing and accountability, helps think people twice of committing crimes, those who do it aware, helps address injustice where crimes have been committed, and simultaneously, where there is injustice, and that's why doctors also pay significant amounts of money for their insurance. It's not the doctor, and if doctors are not if doctor makes a mistake, that's what the insurance they're paying a lot of money for, which is very costly. It is for. So insurance companies are profiting. By the way, the core room is in an insurance building, so if that is a slap on the face to someone like myself who has been hurt and who is being denied justice, it's something like of that sort. A courtroom where the insurance company building is denying a very substantial with evidence obvious medical malpractice case of two people who have been harmed for the rest of their life, turning into a system only to be abused and the system to be gouged, etc. It goes to say something. And things like that are to be kept in mind when you're making laws, because it is, after all, those cases and those scenarios that show you where the necessity is. And that's why I'm sharing my story in the way that I do. And that's why also sharing my knowledge as well, even though I'm often not recognized or understood or in any sense, both for the situations I deal with and the knowledge and the other things that I share that helps people in different areas. So to wrap it up, it is obvious what kind of things can help. And I think going through these areas for the leaders who have been meeting in the next last few days and will be meeting in the next few days to talk about it, some things to keep in mind.